Insomnia, how to fall asleep quickly and forget about it. Interesting about science and medicine prepared by editor of a channel all scientific. Who is most likely to suffer from insomnia? Insomnia is a very common disorder. Half of the adult population is predisposed to insomnia. Women suffer from this disorder more often than men, and older people are also more likely than younger people. Is sleep quality important? Sleep is generally a very sensitive condition. The main characteristic of sleep is its quality. Many people with insomnia may actually sleep most of the night, but they feel sleep deprived or sleep very poorly. The main rules for good sleep. To sleep well, it's important to follow some very important rules. Keep to your own schedule. Feel comfortable and safe. Remain calm. What does sleep consist of? Sleep consists of several phases, each lasting 4-6 cycles. These cycles repeat throughout the night and last approximately 1.5 hours. What type of sleep are there? There are two types of sleep. Slow wave sleep, which consists of 4 stages. The first stage is light sleep and the fourth is deep sleep. Rapid eye movement REM sleep, during which dreams occur. Deep sleep is typically the beginning of a night and allows you to recover from a difficult day, while REM sleep occurs toward the end of a night. Signs of occasional insomnia. This type of insomnia is the most common. The main symptoms of this disorder are difficulty falling asleep, frequent nighttime awakening. Causes of occasional insomnia. The main causes of occasional insomnia are everyday worry, what we think about before bed, painful conditions that cause discomfort and various unpleasant sensations, cold, prostatitis, frequent urination, itching, stimulated drinks, tea, coffee, alcoholic beverages, some carbonated drinks, cola, medication, asthma medication, theophylline, hypertension medication, thyroid hormones, anti-inflammatory corticosteroids, temporary change to your schedule, time zone change due to traveling abroad or to a remote area of a country. Treatment of occasional insomnia. Sleeping pills, hypnotics. If a patient has no temporary way to cure or correct the underlying cause of their insomnia, they can use hypnotics, sleeping pills. Use it only in isolated cases they pose no health risk. Caution, please note that hypnotics are available only by prescription. These medications have many contraindications. Because not everyone reacts the same to sleep aids, it may take time to find the right one that won't cause problem not only with falling asleep but also with waking up. Treatment of occasional insomnia, other means, other remedy. There are other remedies that can help someone with insomnia. Warm bath, exercising during the day, not before bedtime, engaging in enjoyable and relaxing activity. All these factors help you relax physically and mentally after dinner. Causes of chronic insomnia. Chronic insomnia is typically associated with physiological and, the worst case, psychiatric factors. Physiological causes of insomnia. Chronic insomnia can result from the accumulation of numerous episodes of occasional sleeplessness, which create a habit in the body. As a result, the body no longer associates sleep with being in bed. Typically, such people experience sudden onset of sleep, even when they aren't thinking about it. Mental cause of insomnia. Most mental illnesses are accompanied by insomnia. This is especially common with depression. Depression is characterized by sleep disturbance that prevent the sufferer from resting. They have difficulty falling asleep and wake up frequently during the night, often waking up very early with feeling of anxiety and restlessness. Treatment of chronic insomnia. To overcome insomnia, you should change bad habits. For example, not going to bed too early due to fear of sleep deprivation. Restoring the ability to fall asleep requires careful preparation. Some medications, sleeping pills, can be helpful, but they should only be taken for a short period of time until the body learns to fall asleep on time. Treatment of chronic insomnia in case of depression is included in the treatment of depression. Sleeping pill abuse can cause depression. Most medical facilities offer specialized consultation for the treatment of sleep disorders. Depending on whether the patient frequently sleeps poorly or sleeps excessively, the doctor can determine the disorder, make a correct diagnosis, and prescribe a recommended treatment. Sleep apnea. Apnea is characterized by pauses in breathing lasting 10 to 45 seconds when occur only during sleep. A feeling of suffocation awakes a person, but when they fall asleep again, they experience the same feeling again. Night become nightmare for snorers, which is why they often fall asleep during the day. Sleep apnea is especially common in men over 50. Sleep apnea is especially common in men over 50 who are overweight. Early diagnosis of sleep apnea helps avoid potential health risks, brain disorder, sudden death during sleep. Use of sleeping pills. When using sleeping pills, it's important to follow an important rule. Use them only for a few days or a few weeks at most. This medication can quickly become addictive. The main signs of this addiction include withdrawal, recurrence of insomnia after stopping treatment. Gradually reducing the dosage of sleeping pills can help relieve withdrawal symptoms. Thank you for your attention. This material is prepared by editors of a page. All scientific attention. This material is for information purposes only. When observing very unusual symptoms, it's recommended to consult a doctor. Subscribe to our channel. Thank you. Bye bye.